most people at this point in time have heard about SIBO, small intestinal bacterial overgrowth, but SIFO is its fungal cousin. And while bacteria often take the blame for gut issues, fungi, specifically species like Candida, can also overgrow in the small intestines, leading to bloating and abdominal pain and fatigue, and really just a host of other issues. Well, hey, I'm Dr. Hagmeyer, and today I'm going to talk about what causes SIFO, talk about who's at risk, talk about some of the symptoms that you should be aware of, how SIFO is diagnosed, and really how we approach treatment in a functional medicine perspective. So what is SIFO? SIFO stands for small intestinal fungal overgrowth, and it happens when fungi, most commonly yeast like Candida albicans, grow excessively in the small intestines where they really don't belong in these large numbers. Unlike the colon, which is designed to really handle a diverse population of microbes, the small intestines is really supposed to have relatively few to no of these organisms. Now, when fungal organisms overgrow, they disrupt digestion, nutrient absorption, immune balance. They really wreak havoc on the body. So what are some of the causes and risk factors of SIBO? Why does it happen in the first place, right? Why would this fungal overgrowth take place in the small intestines, right? Well, there are several causes and risk factors, and many of these are lifestyle or metabolically related, right? They could be antibiotic use. We know that broad spectrum antibiotics wipe out our beneficial bacteria in the gut. And without these protective barrier, yeast like Candida, they flourish and they go unchecked. We also know that proton pump inhibitors, PPIs, and low stomach acid can be the cause. Stomach acid is our first line of defense against these pathogens, and when acid levels drop due to medications like omeprazole or chronic stress, these fungi can now pass through the stomach and settle in the intestines more easily. We also know high sugar diets, high carbohydrate diets, yeast thrive on sugar and refined carbs. So again, a high processed diet, alcohol, and excessive fruit can also cause this overgrowth. In patients that have undergone chemotherapy, immune suppression drugs can also do that. Uncontrolled diabetes patients are also at much higher risk. Prior GI infections, dysbiosis, food poisoning, chronic gut imbalances. These, again, all pave the way for this fungal organism to take hold. We also know that slow gut motility, especially for people that have hypothyroidism or people that have constipation or people that are taking Wegovy or Ozempic. We know that these medications slow down motility in the gut. So in functional medicine, obviously we're always asking the question, why? What is the trigger? Was it a medication? Is it a diet pattern? Is it a stressor? Is it a combination of all of these things? But identifying the triggers becomes crucial because treatment isn't just about killing this fungus. It's about removing what it allowed it to thrive and make sure that the terrain of the gut is strong enough to prevent a reinfection. So symptoms of SIBO really can overlap with the symptoms of SIBO and other gut issues, which makes it, again, tricky to diagnose. Common symptoms, again, just like SIBO, include persistent bloating, abdominal distension, feeling worse after meals, gas and burping, sometimes with a yeast-like odor, sometimes, again, abdominal discomfort or even pain, and in some individuals, loose stools, diarrhea, constipation. Then there are things like food sensitivities, especially when you're eating carbs or proteins. There could be skin issues, rashes, and fungal infections. So you see, there are a lot of different symptoms that can go hand in hand with SIFO, but also with SIBO. All right, so now let's talk a little bit about how we treat SIFO in the world of functional medicine and how it differs from, let's say, a conventional, traditional medical approach. Again, in conventional medicine, treatment often just focuses solely on antifungal medications, maybe fluconazole or nystatin. And while, again, these can be helpful, they don't address why the overgrowth occurred in the first place. In functional medicine, we're going to take a multi-step approach. Obviously, we want to remove and knock down the overgrowth. This can involve prescription antifungals like nystatin or fluconazole, but sometimes these also have to be paired with herbal antifungals, such as oregano oil and caprylic acid and berberine and garlic extract, powder 𝐷𝐴_𝑘𝐒, which again can also be very effective and sometimes even better tolerated than some of these antifungals. Now, the next thing, obviously, we have to think about is we have to think about starving the fungus, starving the yeast. Now, this is a low sugar, low refined carbohydrate diet is crucial. We also may use a modified low FODMAP diet or an anti-candida diet to reduce those fermentable foods that are feeding the fungi. Supporting digestion and immunity, restoring stomach acid and bile flow is incredibly important. This can help prevent the reoccurrence. We may use nutrients like zinc. We may use digestive enzymes. We may use bitters to help support digestion. We're going to need to re-inoculate the gut with good types of bacteria and good types of yeast. We also may need to use biofilms. In fact, recently I did a video that specifically talks about why most yeast infections come back, why most bacterial overgrowth, people who have SIBO, why most bacterial overgrowth infections come back. You may want to watch those two videos as well. But here's the thing, if we don't identify and correct the underlying driving factors, this overgrowth just continues to come back time and time again. All right, so key takeaways from today's video is that number one is that SIFO is often underdiagnosed, and it's very common when someone already has SIBO. Or other gut symptoms, I should say. And if you've undergone standard treatment and you haven't noticed improvement, that's an issue. Risk factors are going to be antibiotic use, low stomach acid, high sugar. Again, symptoms are going to often mimic SIBO. So again, careful consideration is needed. Functional medicine approach focuses not just on killing the fungus, but also on diet, digestive support, probiotics, prebiotics, biofilm disruptors to prevent the reoccurrence. If you suspect that you have SIFO, work with a practitioner who's experienced in both testing and the functional treatment approaches. With the right plan, most people can get lasting relief and restore a healthy, more balanced gut. Well, I'm Dr. Hagmeyer, and I hope this video helped you better understand SIFO, what causes it, how to spot it, and how to treat it holistically. For more information on gut health and functional medicine testing and natural treatment approaches, be sure to check out my website and subscribe for future videos. If you like this video, here's another video here and over here that I think you're also going to enjoy watching. Until next time, take care.